Mr. Tipton.
Thank you, Mr. Chairman. Thank you, Mr. Cohen, for being here. And I'd like you to explain to me and help me to be able to understand. I think that we keep experiencing from this administration bait and switch. You just made the comments that we're seeing rates rising at slower levels than they have over the previous decades that have been going out. Didn't the President promise us that we were going to be having lower rates, not lower rates of increase?
So I think that over time, I expect that will happen. I don't think it's
So you're promising
reasonable or
our rates are
necessary.
going to go down?
I think over time, as there's more competition, it's again important to recognize that the health insurance market in many states has been extremely concentrated, and there's been one dominant carrier that has, in some states, as much as 75 or 80% of the market. And I think we're just beginning to see, this is just the not even the first year of the Affordable Care Act is in place. I think we're beginning to see signs in some places where increased competition has resulted in decreases in rates.
Okay, so again, this administration is going to make the claim that they're going to ultimately lower rates for Americans. We'd like to be able to hold you to that. But really, this is about fairness. Isn't that what you're trying to say? We want to have it fair for the American people, fair for small business. Is that right?
Yes.
It is. Then perhaps you can explain for me, NFIB, we just spoke to them out of the state of Colorado. If you happen to live in rural Colorado versus urban Colorado, you are paying a premium under the President's so-called Affordable Care Act. Explain to me how that's fair.
Congressman, I think you would find that
no, this is coming from the NFIB.
No, I think you'd find that rates in rural areas have been higher than rates in urban areas historically.
It's
not new.
Fair. It's fair to punish people who live in rural America?
No, not at all.
Where wages are lower, where access is lower. The administration is comfortable with that?
I'm just saying it's not because of the Affordable Care Act. I'm saying that it's because of a number of other factors, including the cost of providing medical care.
The Affordable Care Act coming out of rural Colorado, you can be paying anywhere from 65 to 100% premium just because you live in a rural area. That's where a lot of small businesses in my area come from. How's the administration helping them with this policy?
So I think that with increased competition, we are hoping that there will be more issuers offering health coverage in both rural and urban areas, and that will have, what we've seen is if you look at states where there's more competition, rates are lower. When you look at states where there's not a lot of competition, rates are higher. That was true before the Affordable Care Act, and that's something that we expect to change over time. But the discrepancy between medical costs of providing medical care in rural and urban areas is not new or something that was caused by the ACA.
That's not what the President promised us when we were talking about introducing this now law on the American people. They were going to lower our costs. We're seeing rural Americans suffer in our areas, our small businesses seeing their costs go up. And I've got to tell you, Mr. Cohen, this is very disturbing coming from a rural area with a lot of small businesses. The lack of compassion that this administration is showing for these small businesses. How many small businesses have canceled those policies now that the President unilaterally made the decision to extend it, not giving it to individuals, by the way, but to small businesses, as he gave favor to big business earlier on? How many businesses canceled policies? Do you know?
I don't know, but
you don't have any.
But I think it's important, just in reference to what you just said, the requirement that employers offer coverage does not extend to small businesses in the Affordable Care Act. It's only to large employers. So there's no connection between those two things. It's always small employers' choice whether to offer coverage to its employees.
I'm going to run short on time, but you keep inserting the word, we hope something's going to happen. We hope the website's going to work. We hope we're going to be able to lower costs. Doesn't give a lot of comfort to many of us, but you keep pointing to the credits. Small business guy, who pays for the credits that are going to be issued by the government?
these are tax credits, and it's ultimately
for
paid
them?
by the Treasury and by the American people.
Who provide? Oh, so the American people get to pay for. So actually, there's no real net savings. Sooner or later, somebody's going to be paying the bill. Is that accurate?
I think as with many things that taxpayers pay for, there will be a benefit to society as a whole for making it possible for small businesses to provide health care coverage to their employees. We all benefit when people are
So the American
healthy,
people will
are
pay for it.
productive, and have good access to health care.
Federal government mandates, the American people pay, small business suffers, and people in rural America perhaps the most. I see my time's expired, Mr. Chairman.
Thank you, Mr. Schrader.